Let's do a real quick recap on how these hormones are affecting our joints, and then let's just jump into the menopause after that.
Sure. So I think that one of the things everybody needs to understand, and certainly your listeners are better at this than most people, but is it really all of those diseases of aging, be it dementia, be it cardiovascular disease, be it hypertension, metabolic disease, all of those things that we see, infections that we see increase as we age, are all related to disruptions in kind of our immune systems and dysregulation in our bodies. And so people have kind of started to think about all these diseases as, hey, maybe the one link is that our cells are aging, our immune systems are aging, and we can't fight off these diseases. But our aches and pains, our back pain and our knee pain have sort of been not thought of in that realm. We always sort of think of those more as just like wearing out your tires on your car, that it simply is too much wear and then you've got to change them out. And that's really not the case. Osteoarthritis, a wear and tear type of arthritis, is back pain. Reason they increase as we age is the same reason all these other diseases do, and that these are disruptions in our immune systems, in our aging processes. So how do we avoid that? How do we keep our immune systems healthier? How do we get our cells so that they can regenerate? How do we get rid of bad cells that are doing damage? Your listeners all know about senescent cells. Well, we have senescent cartilage cells too, right? The same thing that's happening in your heart, in your brain, is happening in your joints. And unfortunately, if you think about people, how do we treat an arthritic knee? We go in there and we sort of scrape out we trim off the bad cartilage, and we call it a cleanup of the arthritic joint. And I always tell people that's akin to going to my Alzheimer's patient and go, oh, let me just go clean out those bad parts of your brain, right?
Yeah.
It's not going to work. In fact, I've just made them worse because I just removed parts of their brain. The same thing happens in joints, right? As soon as you start trimming away the joint, the typical orthopedic cleanup, that you've actually done more damage. You've taken away parts of the joint. So we have to start thinking about this disease the same way you guys are thinking about other diseases, and getting the immune system healthy. So how do we, what is the, first and foremost to that in my mind, obviously diet and exercise are, always going to come up first. And that's kind of a given. So we won't spend too much time on that. You guys know that if we're never going to undo anything if you just want to eat, sugar all day long, but, and sleep and not exercise, you know, but we can help. And and we do know that one of the things that happens is as our hormones decline, our immune systems decline. So every one of our hormones plays a very vital role in our immune function. And that's testosterone, estrogen, progesterone, thyroid hormones, cortisol, so adrenal hormones. All of those hormones are vital. And so to say, well, it's okay to just get old, well, and that's what's supposed to happen is our hormones decline. Well, the problem is that without the hormonal support, can you really get the immune support you need to protect your health? And the answer is, in my mind, probably not. You have to have all those hormones and you have to have them balanced. And it's really all of them. I mean, it's not really just saying, okay, you just need estrogen, you're a woman. It's all of them. So that's so the first, just to kind of, the first caveat you have to remember is that this is an age related disease. Joint pain, back pain is an age related disease, just like all those other diseases you guys are learning about and reading about, right? And so don't think about it any differently. Every one of them is part of inflammation. It's chronic inflammation due to a disruption in the immune system. I'm lecturing this weekend at Peptide World Conference with Seed Scientific Research Performance, and I'm lecturing on exactly that, on the immune system aging, how that is probably the cause of all these diseases, and joint disease is the same thing. So that's sort of my long diatribe of that. Number one, learn that joint pain, back pain are the same as all those other diseases of aging, and so you have to prevent aging to prevent them. And number two, in my mind, that's very difficult to do. Not impossible, maybe, but very difficult to do without using hormones as well.